Welcome back to Fluvoxamine Frontiers, Battling COVID-19, where we are diving deep into fluvoxamine's role in the pandemic. I'm your host, Dr. Soma Rohatgi, joined by our guest, Saakshi Sharma, who has a keen eye for clinical details. Today, we are tackling a critical topic: the safety of using fluvoxamine for COVID 19. Any drug comes with risk, so how does fluvoxamine balance safety and benefit? Think of fluvoxamine as a medicine with life saving potential but a bitter taste, side effects that need careful consideration. When repurposing a drug, we weigh these risks against the benefits to ensure it's a safe choice. What does this look like for fluvoxamine in COVID 19 patients? Let's explore it. Saakshi, let's get practical. What are the common side effects of fluvoxamine when used for COVID 19 treatment?
Dr. Soma, the side effect profile is an important piece of the puzzle. In trials like the Stop COVID study, common side effects included nausea, which affected about 10 to 15% of patients, as well as dizziness and insomnia. Some patients also reported headaches or mild gastrointestinal upset like diarrhea. These are very similar to fluvoxamine's known effects in psychiatric use, but tend to be mild and short-lived, especially since COVID-19 treatment is typically just 10 days. In a 2021 outpatient study in California, a few patients noted drowsiness, which can be bothersome but usually resolves. Serious side effects like severe allergic reactions were rare, making fluvoxamine relatively tolerable for most.
So it's a bitter taste, but not a deal breaker for most. How do these risks stack up against fluvoxamine's benefit in COVID 19 treatment?
The risk-benefit balance is where fluvoxamine shines. The benefits, as seen in trials like Stop COVID, where it reduced severe outcomes by preventing progression to hospitalizations, are significant, especially for high-risk patients. The side effects, while uncomfortable, are generally mild and transient as compared to the risk of severe COVID-19, which can lead to ICU stays or even worse. For example, in a 2021 study in India, fluvoxamine cut the need for oxygen therapy in outpatients, a huge win when hospitals were overwhelmed. The trade-off is clear. Temporary nausea or dizziness is far less risky than the lung damage or clotting, as seen in severe cases. This makes fluvoxamine a strong option, particularly when started early.
That's a compelling case for its value. How do clinicians manage these side effects, especially in vulnerable populations like the elderly or those with comorbidities?
Dr. Soma, managing side effects in vulnerable group requires careful navigation. For the elderly or those with comorbidities, clinicians often start with a lower dose, say 50 milligrams daily instead of 100 milligrams twice daily, as tested in some outpatient studies, to minimize nausea or drowsiness. They also monitor for drug interactions, since fluvoxamine affects liver enzyme like CYP1A2, which can alter levels of other medications, as noted in a 2021 Canadian study. Timing doses with food can reduce stomach upset, and clear communication helps patient understand what to expect. For example, in a trial with older adults, clinicians used regular check-ins to ensure adherence despite mild side effects. It's about tailoring the approach to keep patients safe and comfortable while maximizing the drug's benefits.
So it looks like that it's all about steering carefully to keep everyone on board. Fluvoxamine is a sturdy lifeboat, safe for most, but you need to know how to steer it. With mild side effects manageable through careful dosing and monitoring, it carries patients away from the stormy seas of severe COVID 19. Thank you, Saakshi, for guiding us through fluvoxamine's safety profile. Listeners, keep sailing with us on Fluvoxamine Frontiers Till then, stay curious. Science always has more to uncover.